It's Friday, December 10th, coming up on an all-new View. Going bald isn't just his problem. So the View MD's examining how female hair loss affects 40 million women. Warning signs you may be one of them. And the best ways to deal with it now. All that, hot topics and more, coming up on The View.
You may think balding is a guy problem, but female hair loss affects a staggering 40 million women, some as early as age 35. So right now, we are finding out everything about the problem called the dirty little secret of dermatology. Please welcome Dr. Doris Day.
Okay.
Wow.
Why is that a dirty little secret?
Well, you know, there are a few things that I see in my practice that are more devastating than female hair loss. I can see the smartest, most confident, most beautiful woman, and as soon as she starts seeing hair falling out, she falls to pieces. And the numbers will surprise you. Up to 50% of women by age 50, and even higher in African Americans, where 2/3 of women by the age of 50, African American women, have significant hair loss. And it starts earlier in women than it does in men. So even in their early 30s, late 20s, women already notice hair loss.
Is it more devastating to women than to men?
You know, men have choices. They may not like losing their hair, but it certainly doesn't affect their ability to get a job, to get married, to have kids. But women start losing hair, and they don't want to go out. They don't socialize.
Does it affect us the same as far as the hair loss?
Men and women do have different patterns of hair loss. So men will notice a temporal recession, and they'll see the hairline receding and then loss in the crown. Women keep the frontal hairline, and then they lose in the crown. Some have it more focally. Some can lose it very diffusely over the whole crown. But there are different types of hair loss in women. So there's one called telogen effluvium. Now this is not a true hair loss. It's really a hair shedding, where 3 or so months after a stress, the hair goes into a different cycle. And so you may lose up to 40% of your hair. So this is after childbirth or chemo or marriage or divorce or some major stress in your life. But that hair does grow back. The next type is something called alopecia areata. These are round patches of hair loss. It's an autoimmune condition, and we now have a genetic understanding behind this, so we might be able to find treatments for it. And but this should be diagnosed by your dermatologist. Another type of hair loss is called androgenetic alopecia. This is true hair loss, tends to be inherited from either your mother or your father's side, or sometimes both if you're really unlucky. And you see a widening of the part early, and then it kind of goes like the charts that we saw where you lose in the crown area. Then another type that was more common in African American women was traction alopecia, but now with hair extensions and all the different treatments that we do in the hair, it can cause permanent scarring hair loss, and that's really problematic.
Extensions and stuff.
And all the relaxers and different treatments we're doing.
Processing too much.
Yes, processing and pulling, tight ponytails or braids.
But that's temporary, right?
No, over time it becomes.
Oh, really?
Yeah. If you do it enough, it can be permanent and scarring. Lynn has a lot of public appearances and was really concerned about her hair loss. And she has the androgenetic type, the inherited type, that was getting worse over time. So she came in, and for about a year we've been doing low-level laser therapy for this. And today I have the IllumaWave with me, and this is a very nice treatment where it has over 180 diodes. These are low-level lasers that are true laser biostimulation of the follicle. And you sit under it for about 20 minutes at a time, and over 80% of people will have the hair stop falling out, and a significant number will have the hair grow back, thicker, darker, fuller. Her hair had gone gray. She was coloring it lighter, and the new hair is growing in black in her original color.
Does this work on a man?
This works on men as well.
As well as African American women?
Absolutely. Great results. And I have some before and after for you.
Baldness, you can use this and it'll grow the hair back?
It depends how far along. The closer you get to having, so it's much easier not to lose the hair than it is to replace it. So sometimes you're doing your friends a favor if you kind of notice a little bit of a pattern, just to sort of have that conversation with them, because there's so much you can do these days.
Now, what does it cost?
It varies in cost depending on how much you're doing, so it goes by time. Typically, it's a few $100s. But you know what I find is that for women who are losing their hair, to not lose your hair, you think about what we spend on colors.
Our thanks to Dr. Day. Her book, Forget the Facelift, is available online and in stores now. For more information, you can check our website. We'll be right back.